Good afternoon, everyone. Let's stop that. Good afternoon, everyone, and welcome to the next in our live Old Blue Talks. Throughout the talk today, please feel free to put any questions you like into the Q&A box at the bottom. We will get round to them at the end of the talk. So I'm going to hand over, welcome Monique Maroney.
Thank you, Gina. Thank you for that welcome. Let me just see if I can see any of you. One sec. Okay, so it's lovely to meet you all. I'm here to talk about mindfulness with you, and I'd like to welcome you all today. What I'd like to do first of all is to have a very short practice to start us off, to kick us off. It's very, very strange. I can't see any of you at the moment, but I'm just looking at myself. But let's give it a go anyway. Okay, so to begin with then, I'm just going to do a very brief hello to ourselves. You said hello to me, now let's just turn the spotlight on ourselves. So when you're ready, making sure your feet are on the ground and you're feeling comfortable and supported, whether you're sitting, standing, lying on your bed, whatever it is, just making sure you're feeling supported and safe and fairly comfortable. And if it feels okay for you, just shutting your eyes and taking a few moments to notice that you've arrived. So we're coming directly into the present moment, noticing any thoughts, or emotions, noticing how the body's feeling, settling in, allowing yourselves to settle down. And just noticing that you're breathing in and out. You're bringing your attention to your breath. Allowing yourself to take a nice deep breath in and letting go on the out breath. And again, another nice deep breath in and letting go on the out breath. So settling down, noticing you've arrived, welcoming yourselves, saying hello to yourself and hello to this little community that's here today. And maybe asking yourself what you want to get from this session. Just allowing the question to be there. It doesn't need to be answered just yet. What do you want? And when you're ready, maybe stretching your fingers, toes, opening your eyes, and hello again. So I'm talking about mindfulness today. So the idea was to talk about mindfulness, describing what it was, a little bit about how it's practiced and who benefits from it. But I'm also going to tailor it a little bit because that sounded a little bit dry to me. So I've tailored it to hopefully our sense of resilience over this really difficult period as well. So when I'm thinking about what mindfulness is, I'm reminded when I first started out as a psychotherapist, I started out as a CBT therapist. And CBT is very much a model-driven therapy. So you would have social anxiety or you would have panic, and there would be a model that you would follow in that. So it follows certain stages. And each one is obviously idiosyncratic to the patient, but it does follow a model. And I took one patient to supervision once with a really great supervisor I had, who was head of supervision at psychotherapy at the Maudsley, Stirling Morey. I was really uncertain about whether I was working closely enough to the CBT model. And I asked him, look, I'm really not sure about this. And he paused and he said, well, did it work? And I said, well, yes, it did. And he said, well, it's got to be CBT then. And that's how I feel about mindfulness, really. I think we've all known real moments of mindful awareness in this very difficult year. So those moments where you connected with seeing a flower grow outside, getting a sense of not just looking at it, but really seeing it, really feeling the earth that it gets its nourishment from, feeling yourself grounded in it, just moments to moment awareness, moments when you felt real joy at being able to talk to your family, or real joy at coming to the community online. And also getting a sense of tapping into the sadness you might have experienced, the difficulties. These are all very mindful moments. So what is mindfulness then? John Kabat-Zinn, who really started off the whole mindfulness as a secular activity in America, he said it was awareness in the present moment, and most crucially, non-judgmentally. So taking that as a guide to what mindfulness is, we've all been mindful throughout this pandemic. We've known how it feels when things are right. We've practiced this non-judgmental approach to life. And that's a key word, I think. It's not just noticing things, but it's being non-judgmental. So moments when we've been self-compassionate, we've been kind to ourselves, and we've committed some action to looking after ourselves in these difficult moments. So as a brief summary then, it's about awareness, it's about being non-judgmental, and this idea of self-compassionate, kind approach to ourselves. So it's awareness of the mind, but also very much awareness of the heart as well. And we know when it happens. So I'm describing it to you, and you're probably thinking, yes, I remember feeling that. We know when we're feeling mindfulness because we can feel it in our body. It's a sense of opening up to whatever's there, and a sense of opening up to maybe vulnerability, softening, and you can feel it in your heart. You can feel your heart expanding. We know when it happens. But we also know when we're not feeling mindful. And that's, again, something we can really sense in our bodies when we're feeling a sense of fear or a sense of being totally fed up. We can feel our body closing up. And we can also know when that happens. We can feel that. So I'm going to just take a couple of minutes now to have a little experiment with you. And what I'd like you to do, because it's about our tricky minds. Our minds are really the best things, but they're also slightly tricky as well. So I'm going to show you what happens when that sense of being unmindful might take over. Okay, and again, this is going to be an little experiential exercise, kind of fun. What I'd like you to do, again, is just close your eyes, settling down again. And just for a few moments, it's still about Easter time, just for a few moments, I'd like you to imagine in your mind a little rabbit. Okay? So it doesn't have to be a little rabbit, it can be a big rabbit. It can be like Harvey, the invisible rabbit. Any old rabbit you'd like in your mind, but I would like you to try and make that image as strong as possible. So just allowing it to be there. And when you've got a strong enough image, I'd like you to open your eyes again. So, how did you find that? Quite easy to do, to get that image? Yeah, good, excellent. So what I'd like you to do now then is to stop thinking about it entirely. So I'd like you to get that image completely out of your mind. Stop thinking about it. No, stop thinking about it. Let it go. And I bet that's not quite so easy, is it? Now, some of you might have done something quite clever. You might have been thinking about something else. So I'll think about what I'm going to do today. So you start thinking about that. Nice. And of course, what you're trying when you're doing that, you're thinking about something else. Stop the image of the rabbit from being there. So in a way, it's almost worse. You're starting to contaminate other areas of your thinking. So as you're trying to push that image, push it away, what's happening? It's interesting, isn't it? So the more we try and push away an image or a thought, the stronger it comes back and the more powerful it seems. So when we're thinking about rabbits, who cares really? No one cares. If you're thinking about a thought that is very difficult for you, if you're thinking about a thought like, I can't do this, I'm useless, and you're trying to push that away, that's where the difficulty comes in, because it comes back stronger and stronger and stronger. So that's leading on to my second little bit, I guess, which is we know we're mindful. We know the good minutes are the good moments of our lives. And we know the bad moments of our lives. But why would we bother practicing it? Why would we bother spending up to 45 minutes a day doing meditation, or 15 minutes a day, or 10 minutes a day? Well, the reason we do this is because with mindfulness, what we're doing is we're trying to see that life is really good. We get more of the good moments and less of the bad moments when we're practicing this particular technique. When I was a few years ago now, I was going through a difficult period of my life at work. And every time I used to come back from work, I used to be terrible. My son would ask me, Mum, how are you feeling? And I would say, oh, it's been very difficult. And I would spend the next 10 minutes talking about how difficult it's been. And this went on for maybe about 6 months, it was a long time. And finally he said, Mum, do you know, every time I ask you that, you tell me what's going on. You've never once asked me how I'm feeling. And out of the mouth of babes, I thought, goodness, that's absolutely right. And what is going on here? And of course, what was going on is I'd got into this very habitual way of thinking about what was going on in my life, not allowing other different ways of seeing, different perspectives in on things, and also not allowing a sense of kindness towards my own son. So it really got me thinking about our habitual ways of driven behavior, I guess it would be. So with mindfulness, what we're doing is we're really taking a little step back. With a lot of therapies, they're looking at thoughts. With mindfulness, you're looking at the process of thinking. You're taking a step back and just noticing all the thoughts that are going through your mind. Also, quite importantly, is this idea of, again, I'm going to say it again, this non-judgmental approach as well. So you're noticing the thoughts, You're not getting stuck in that tricky mind of pushing thoughts away, and you're doing this with a sense of kindness and noticing. So when you're noticing thoughts like, I'm useless, or I can't do this, you're bringing a sense of kindness to it. So again, let's take a little experiential exercise for this one. So when we're thinking about our problems, our tricky mind, going over it, trying to solve things, trying to open it, what our minds are doing, if you just hold up your hand and you make a fist of your palm, it's very tight. This is how we kind of see our problems. And what often we try and do is prise them open. So again, just trying to open that fist up with your other hand. Give it a really good go. It's virtually impossible, isn't it? Virtually impossible. This time, again, holding your fist as tight as you can, you're not letting go of that problem, but rather than trying to prise it open, just rest it gently, there we go, on your other fist. The one palm is open and you're resting that tight fist on top of it. And just notice what happens. So if you're like me, that palm, it's quite difficult to keep the same intensity, and it starts to open up a bit. So this is, I suppose in a nutshell, this is the process of mindfulness, is holding gently and allowing things just to be there. You can feel that your palm, your open palm, is all it's doing is holding your other hand. But when that's happening, you can feel things softening and opening, and a sense of space being created. A nice feeling. So that's mindfulness, practicing getting more of the good moments and less of the bad moments, not because you're having less bad moments, but because you're able to deal with them in a more effective manner. So a little bit of the history. I'm running a little bit short on time now, but I want to finish off as much as I can. A little bit of the history of mindfulness, and it started in the States as a stress reduction program. And this was Jon Kabat-Zinn, who had people coming in, and they were people that everyone else had kind of given up with. In medicine, I'm sure there may be a few people out there who are involved in medicine. People in chronic pain tend to be heart sink patients. No one really knows what to do with them. And actually recently there's been the talk about giving no medication out anymore because it's just not useful enough. In the States, what they did was they sent these kind of heart sink patients off to Jon Kabat-Zinn, who did mindfulness practices with them. And he found at the end, they didn't take the pain away, but they responded differently to their pain. And exactly the same thing really was happening over here once they'd decided to do depression for doing mindfulness for depression. It was allowing people to feel sad and depressed. I wasn't saying you mustn't do this or you mustn't, trying to take it away, allowing them to see a different way of dealing with their depression. Now, it was really interesting because relapse rates from depression are really high. If you've had one period of depression, the chances are you will have another within 6 months. So people really wanted to be able to stop that mechanism from happening. And they thought with depression, you could actually, if you could manage to stop depressive thoughts, then that would stop the depression from starting again, the relapse. And the research has shown, I mean, it's really interesting in that rather than stopping the thoughts, if you just manage to catch a sad mood and you stop that from developing, then you can have a really huge effect on relapse rates. So with mindfulness, there was a reduction in half of the relapse rates, which is a really strong clinical difference. And they did a lot of this from dealing with depression in a very different way, dealing not just with that process of thinking, but bringing it deep into the body. So noticing how the body was feeling in depression. Noticing what those sad moods feel like, catching them right at the beginning, and having that gentle sense of exploration, that sense of holding things gently in your awareness. So there's been lots of adaptations for schools, for Houses of Parliament, they're doing it for MPs, and for prisons. There are different adaptations, but the work basically is the same. It's this idea of coming to meet yourself with kindness and compassion. When I was working in HMP Thameside, I was working with some prisoners there. It was very difficult getting them to react or respond to the kind of mindfulness program at first. I won't go into it now, but when the mechanism of trauma, so a lot of these prisoners were traumatized. It's very different to anxiety or depression, and it's very difficult to get past the traumatic response. And the only way we kind of managed to do it in the end, it was a very strong effect, was bringing kindness right directly into the mindfulness program. Now, why am I discussing this? So I guess we all have our little prisons. We've all known our comfort zones as well. Right now, you know, in lockdown, we've almost had our little prisons, but it's also been a comfort zone. You know, we're in this little bubble. Our world is very small, and stepping outside, which we will be doing in the next few days, isn't it? Is kind of taking us outside our comfort zone. So coming back to this sense of resilience and outside, I think it'd be really, I'm going to set you a challenge actually. So we know that we have our comfort zone, which has been nice, but it's also been a little bit of a prison as well. But stepping outside is quite scary too. It's like we're looking forward to it, but it might be a little bit scary. So how can we take up this challenge of going outside our comfort zone and into that more of a learning zone, testing ourselves a little bit? Okay, what I'm going to ask you to do is increase your resilience. Obviously, you have been really resilient up until now with those moments of mindfulness, being in touch with yourself. And I'm going to ask you to increase it a little bit more. So again, I would just like you to take a couple of minutes thinking about your normal day. And in your normal day, I'd like you to think about all the things you do. And I'd like you to think about things that really nurture you, that give you a sense of that mindful connection, or a sense of joy, or a little sense of contentment. So just thinking, what is it that gives me a sense of joy, of equanimity, a little sense of being connected, marking that off. And I'd like you to also think of your day again, but thinking of things which are quite depleting of your energy. So things which are a little bit difficult, that you sense that you're struggling with. And now I'd like you to take one of each. So one of the things that defeats you. And think if there's any way you can change your approach to that one thing. So is there anything you can do differently when it comes to difficult tasks? And I'm going to ask you to take one of your things that brings you joy or a little sense of happiness, and think of a way you can increase that. So one of each. That'll be your task for today. So Why do we do this? Again, we're thinking about our neural pathways. Remember that habitual thinking with Theo, my son? We're trying to recreate a new neural pathway for a little sense of increasing the joy in our lives, and practicing it, getting our minds to recognize this. And I'm going to now, I think, bring this talk to an end. Thank you all so much for your attention. And we'll go and do a, let's see, a 10 or 15 minutes mindful practice. And so we're thinking about this sense of being aware and this sense of connection and this sense of kindness, increasing our mindfulness. I'm going to again invite you to close your eyes. And of course, you don't have to. You can keep them open, it's entirely up to you. But I'm going to be closing my eyes and starting a short practice. It's like past now. I'll make it about 10 to 12 minutes maybe. So I'm going to invite you now, please, to shut your eyes if it feels right for you. And again, noticing this wonderful body that you're in. So noticing your feet grounded on the floor, feeling that connection to the earth, feeling a part of this little coming together today, this little community on Zoom. So even though we're separate, we're connected here by the screen. And knowing we'll be connecting to our communities in even bigger ways over the next few days. And coming into our body. So noticing that you're sitting here in this moment. Getting a sense of really taking your seat. Allowing your chair or your bed, whatever it is you're sitting on, lying down on, allowing that to support your body, that gentle holding. And when you're ready, just bringing your attention to your breath. Now remembering the mind is not your enemy, your mind is your friend, but it'll go off on its journey. That's exactly what minds do. So bearing that in mind. And every time it does that, just bringing it back to this breath. So when you're ready, just breathing in and out at your own normal breathing, not trying to breathe especially slowly. Just simply breathing and noticing the breath going in and out. Letting the body and the mind settle down. Noticing any thoughts. Allowing yourself to become aware of any emotions. Noticing how this body's feeling. And now I'm going to ask you, if this feels right for you, to remember a time when you were really kind to someone. So allowing that sense of what you felt then to come into your body now. So you might feel a slight lift of your lips as you start to smile. An easing of the heart. So noticing when you felt kind or with a kind thing, kind act to someone else. Allowing yourself to open up to those feelings. And when you're ready, allowing those images or feelings to gently drift away and coming back to the breath again. So breathing in, letting go on the out breath. Breathing in, letting go on the out breath. Noticing when your mind's wandering, bringing it back gently and kindly. Just sitting here in this moment, nothing to do, allowing yourself simply to be. And now when you're ready again, if it feels right for you, and again, you don't have to do this, but just imagining now a time when someone was really kind to you. So again, noticing how this feels for you. So finding a time when someone was kind to you. And noticing how this feels in the body, in the mind, emotionally. Allowing this sense of kindness this unconditional love. Just allowing yourself to feel it. And again, when you're ready, allowing that feeling just to drift off just for a few moments. Coming back to the breath. Breathing in, letting go on the out breath. And finally, again, I'm inviting you to do this, you don't have to do it. But remembering that sense of kindness kindness that someone showed to you, and allowing yourself to show it to yourself. Directing that beam of kindness to yourself and noticing how that feels. That tenderness and awareness. And knowing you can feel this throughout your day as the practice comes to an end. And take this feeling of kindness and compassion and use it throughout your day. So again, just coming back to your breath. Noticing your body once more, your feet making that firm contact with the ground. And when you're ready, stretching your fingers, toes, give your body a good stretch. And when you're ready, opening your eyes. So I'd like to thank you all, and I'm here for any questions.
Hi, I'm just trying to. There we go. I've got one question at the moment, so if there are any more, please do type them into the Q&A, and we'll get through as many as we can. So I've got a question from Bethan, or it might be a comment actually, but the chat's disabled. So she said she finds mindfulness really useful and wondered whether some people find it more helpful than others. So I guess in your experience, are there more skeptics than believers, or what have you found?
That's a really interesting question, though. I would say it actually helps to be slightly skeptical of it all, but to really give it a go. No, it's really interesting. I think mindfulness is really useful for anyone. So it's been used a lot in depression, obviously. It's been used in anxiety. It's been used in schizophrenic type disorders, and people really get a benefit from it. In fact, in the NHS, it's especially useful for people who've been really chronically depressed, which is really interesting. So the people that, again, that kind of heart sink where you're not really sure what's going to work, because things that they've tried all sorts of things in the past. Mindfulness has been a real strong way forward. So in answer to that question, I would say that, I can't find it now, that anyone can benefit from mindfulness, and a skeptical approach is really useful because they tend to be people who will practice but be kind of quite reserved from it, rather than people who think it's great and don't do the practice. So what we're really aiming for, whenever you're doing a mindful, you're trying to bring mindfulness into your workplace or your school, there'll be people who'll be really enthusiastic but won't actually practice, and it's a practice that's really important. It's like I think John Kabat-Zinn calls it your parachute. When you're doing your mindfulness, you're sewing your parachute every day. So when the crisis comes, you've got a parachute that works.
Great, and we've got lots of questions now coming in. So one from Jackie Rolfe, who I imagine you know.
Oh, hi, Jackie, I do know you.
She said, what would you advise the best mindful approach should be to settle nerves or anxiety before an exam or performance?
Oh, that's such a great question. There's a lot of work coming out of trauma, because what happens in the traumatic mind, you can't really settle very well. And so they found that the best way, and it's very old, we kind of almost instinctively know this, but to remember it, I think, is very useful. So when you're practicing breathing, just breathing in, but you're breathing in slightly shorter. So you're breathing in, say, for 5 counts, holding it, and then you're breathing out for about 7. Now, what that does is it sets off your parasympathetic system. So when you're nervous just before a performance, nerves are quite good, by the way. It's always quite good to feel nervous for a performance because you're kind of optimizing your abilities. If you feel like you're tipping over, that's your sympathetic system coming in. It's like your adrenaline's going, your cortisol's high, and when you're doing that controlled breathing, you're just setting off the parasympathetic system. So you're settling everything down. So that's a very easy, nice way to settle your nerves, but also being very compassionate about yourself and thinking, it's very normal to feel like this, and kind of hugging that gentle hugging and compassionate way of being kind to yourself as well.
Okay, so Lucy's asked, if you find it hard to push thoughts away at first, does it usually get easier with practice?
No, not really. because that is the practice. Our mind, that's what our minds do. Our minds are there. They're there. Trying to keep our minds. Our minds don't want to keep us happy. What our minds are really, really want to do is to keep us safe. So all those little tricky thoughts, kind of, how do I keep safe? That's how our minds work. And to kind of recognize that and just bring it back to breath. That's what mindfulness is. It's not about having a mind free of thoughts at all. Sometimes if you're lucky, you'll notice that your mind settles down, and that's really very, very good. But other times those thoughts will be coming in and out and in and out, and that's the mindful. Oh, there's that thought again. There's that thought. Oh, there's that really awful thought about, and then holding it again, because it's that idea of stepping back a little bit from them, noticing them. You're not trying to stop anything. Remember, you're never trying to stop things from happening, but you're noticing. And with that noticing comes a kind of holding. You're being able to hold all the difficult thoughts you have, and you're looking at the slightly a wise mind. So you're looking at a different perspective. So don't try and stop your thoughts, but allow them to happen and hold them in this wiser, older way of being with them. That's what I would advise. And we're always practicing that. There's no one who's an expert in doing that at all. And that's also part of the practice.
Okay. So from Cara, what if you can't see the rabbits? How do autistic people respond?
Oh, that's a really good question. Let me just think about that for a minute, because my son's actually autistic as well. Let me think. I might be tempted to make it very, very concrete. So I would use something else. Let me show you, 1 minute. So my little box of tricks here. I don't know if anyone knows what these are. It's a Chinese finger trap. So when you're in this and you're trying to pull away, you get trapped. So that's quite a fun approach. You get trapped in your thoughts, and the more you pull away from them, the more trapped and tight and horrible it all feels. So what you want to do is to move in, and you're creating this sense of wiggle space, a sense of room, yeah? So I might use that for someone with autism, something very concrete they can actually touch, a bit like Doubting Thomas with the wounds, want to poke your finger in the wounds almost. That answer your question?
I hope so. And we've got, oh, yes, she says yes.
So please.
So do you know if there's any research on the benefits of mindfulness for art appreciation? This is David. He has found mindfulness exercises make it easier for him to deconstruct some visual scenes and enjoy more abstract.
That is I wish my sister might be here today, and she's an artist, and I think she would probably answer that even better than I could. But I do think when you're practicing mindfulness, your perspective will change, and you're more open to the emotions of the picture. That's what I would say. But also, if you're a practicing artist, that in itself is mindful. No, that's not quite answering your question. But I would say yes. I don't know about the research being done. It would be a really good area of research to be done, definitely. As far as I know, there hasn't been any, but it's a burgeoning field. Things are changing all the time, and it would be a great area to do research in. I know that my sister feels very mindful when she's painting.
Okay, I've got one more question in the box. So if there's any more that anyone wants to ask, now is the time to type them. This is not really a question, but it's someone said, how do you spell the surname Cabot? And John Cabot, the chap you were talking about.
Oh yeah, it's Kabat and then Zinn. So he's a really great person to look up. Another one is someone from England called Mark Williams, and he's extraordinarily good. He's doing a lot of the mindful MBCT here. And then you've got people like Rebecca Crane from Bangor, who's also a good name to think about as well. There's two main centres really. There's one in Oxford and there's one in Bangor, and they're both real leaders in the field of mindful, where the mindful research is.
Okay, a couple more have come in. Would you say mindfulness is akin to meditation and prayer?
I would say most definitely. It's it's been around for 2,000 years, and we've just taken the bits off the Buddhist philosophies, definitely. But Buddhism is a great philosophy because it can be seen in a very secular way, and which is where mindfulness is really. It's a kind of secularization of Buddhism. When I first started doing mindfulness, there was a real uproar from people who came from the more Buddhist side of things. It was being changed into this kind of very CBT approach. It was kind of taking away that spiritual element from it. But I think there's also a little step backwards towards that now, a step more towards the kind of Buddhist principles in mindfulness. So it's a bit of a balancing act now. Yeah. So yes, I would say that lots and lots of very strong similarities. And when you're doing mindfulness at master's level, you'll be taught a lot of Buddhist practice as well as part of your mindfulness training. A lot of Pali and Sanskrit and original meanings of particular parts of mindfulness.
Just followed that up with Christian as well as Buddhist.
Yeah, again, I think anything that where you're meditating, so when people are in prayer, that's a meditation. There's definite links with it, absolutely. The only difference is that mindfulness is obviously very, very secular. So there's that sense of taking principles of every religion, that kindness, that being good to yourself, being good to others, and settling down, whatever's there.
Okay, and one more. Do you have any tips on how best to support someone with chronic anxiety that mindfulness might help? And then it could be either, there's no name, they don't like help, exclamation mark.
Oh, who does like help? None of us really likes help. I suppose it's getting to that point where it becomes a real difficulty for the person, and then it may be just to see if they're more open to ways of being helped. Now, the thing that's good about mindfulness, and I wouldn't suggest they go down the mindful path, they might want to consider it, is that it's not actually a therapy. It's teaching you a different way of being with difficulty. So if you're having someone who doesn't believe in therapy, or feels for whatever reason a real sense of aversion, doesn't want to go down that path, mindfulness can be a nice little way to deal with anxiety. Because remember, the first original groups were for stress reduction. So that may be a way forward. Little tips you could give to someone who's feeling extremely anxious. It's very difficult to know because it depends what form their anxiety is taking. If it's about ruminating about how to get out of this, and you might do one particular technique, or if it's just about avoidance of difficult situations, you might try another technique. It'd be difficult to say, and probably a little bit unsafe to say, give more tips online, I think.
Okay, I think we're there. Any more for any more? Cara says, how would you find a therapist?
If you want to find a good therapist, and it depends again, if it's a CBT therapist, which is one I'd always go towards just because it's so researched, there's a backup site, which is BABCP. If you want to find a good mindfulness group, then there's a mindfulness network or the Oxford Mindfulness Centre.
And there's a good one here, because this is what I was going to ask you as well. Lucy says she finds anxiety happens when she's trying to sleep and it takes a long time to sleep. Can mindfulness help with that? I have the same. I will wake up and think, and that's when the demons come out, I always think at night.
You know, I think everyone's had that, haven't they, over this lockdown? I don't know anyone hasn't suffered from insomnia at some point, waking up at 3. Oh, is that 3 o'clock, my usual waking up time? Oh, well, what can I say? I would say, having suffered exactly the same, is to not worry about it, first of all. And it's so easy to say that. But just say, okay, this is the time I'm waking up. That's one thing you can do. The other thing, which is really, really helpful, is if you go to the Bangor website or the Mindfulness Network, they do what's called a body scan. Now, a body scan is just taking you through, it's part of the 8-week course that I was talking about earlier, the MBCT. And the body scan is learning to train your awareness. But what it also does is it brings about a very deep sense of relaxation. So as you're listening to the body scan, almost invariably, I'd love to have this experiment. I'd love your inquiries to come back. Almost invariably, you'll be asleep by the end of it. Body scan.
Okay. That's all the questions answered for now. Obviously, if anyone has anything they want to send on to Monique, just forward them to the Old Blues email address and we'll send them on. We've had some lovely comments put in the Q&A as well, so I will send them on to you. Thank you ever so much for your time today. Thank you for everyone for joining. And the recording will be available from this later at the beginning of May. Some lovely comments coming in. I'll send them on to you.
That's so lovely. It's been an absolute pleasure. Really great. Thank you so much.
Right. Thank you, everyone. We have another talk next week. It's on Wednesday. Details are on the website, as always. Hopefully see you then. Thanks ever so much.
Bye.